Question 1. The performance metrics show a consistent pattern of alarms being silenced by PCTs without immediate verbal confirmation of the rhythm from a registered nurse, leading to a slight increase in patient-reported anxiety. A patient's monitor displays a rapid, irregular rhythm with no discernible P waves and a wide QRS complex. What is the most appropriate immediate action for the PCT? Option A. Continue to monitor the rhythm for a few more minutes to see if it self-corrects. Option B. Immediately notify the registered nurse of the observed rhythm and request further assessment. Option C. Attempt to adjust the monitor leads to see if the rhythm changes. Option D. Document the alarm as a false positive and proceed with other tasks. Correct answer is B. Immediately notify the registered nurse of the observed rhythm and request further assessment. Explanation. The performance metrics show a trend of increased patient complaints regarding perceived delays in response to alarms. This scenario is professionally challenging because it requires the patient care technician, PCT, to balance the urgency of responding to potential cardiac emergencies with the need for efficient workflow and accurate rhythm interpretation. Misinterpreting a heart rhythm can lead to inappropriate interventions or delayed critical care, directly impacting patient outcomes and potentially violating patient safety regulations. The PCT must possess a strong understanding of normal and abnormal heart rhythms to effectively triage alarms and escalate care appropriately. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established protocols for cardiac rhythm monitoring, accurately identifying a normal sinus rhythm versus a potentially life-threatening arrhythmia, such as ventricular tachycardia or atrial fibrillation with rapid ventricular response, is fundamental to the PCT's role. This accurate identification dictates the immediate course of action, whether it's continued observation for a normal rhythm or immediate notification of a registered nurse or physician for a critical rhythm. This aligns with the PCT's scope of practice, which typically includes monitoring vital signs and recognizing significant changes, and implicitly with regulations that mandate timely and appropriate patient care. An incorrect approach of dismissing an alarm without proper rhythm assessment is a significant regulatory and ethical failure. It violates the principle of do no harm and can lead to delayed treatment for a critical condition, potentially resulting in adverse patient outcomes. This action could be considered negligence and a breach of professional duty of care, contravening healthcare regulations that require diligent patient monitoring and prompt response to changes in condition. Another incorrect approach, such as over-escalating every alarm regardless of rhythm, while seemingly cautious, can lead to alarm fatigue for other healthcare professionals, potentially causing genuine emergencies to be overlooked. This inefficiency can also be seen as a failure to utilize resources effectively, which may be addressed in institutional policies and broader healthcare efficiency guidelines. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge the alarm immediately. 2. Access the patient's monitor to visualize the cardiac rhythm. 3. Accurately interpret the rhythm, comparing it to baseline or normal parameters. 4. Based on the interpretation, determine the appropriate next step, continued monitoring for a normal rhythm, or immediate escalation to a licensed caregiver for an abnormal or critical rhythm. 5. Document all observations and actions taken. This process ensures that patient care is evidence-based, timely, and within the PCT's defined scope of practice, adhering to all relevant healthcare regulations and ethical standards. Question 2. Risk assessment procedures indicate that a patient in a semi-private room who is recovering from a respiratory infection requires assistance with ambulation. The patient expresses significant discomfort and anxiety about wearing a surgical mask, stating it makes it difficult to breathe and causes them to feel claustrophobic. The PCT is aware that facility policy mandates mask use for all patient interactions in this scenario to prevent potential transmission of airborne or droplet pathogens. Which of the following actions best represents the PCT's professional responsibility in this situation? Option A. Refuse to wear PPE because the patient is uncomfortable and state, "It's just a mask, it won't make a difference." Option B. Ignore the patient's request and proceed with ambulation while wearing the mask, assuming the patient will eventually comply. Option C. Explain to the patient the importance of the mask for preventing the spread of infection, discuss their specific concerns, and explore if a different type of mask or a brief period of mask use during the most critical parts of ambulation is feasible, while preparing to escalate to a nurse if the patient remains unwilling. Option D. Allow the patient to refuse PPE and proceed with care without any further discussion or intervention. The correct answer is C. Explain to the patient the importance of the mask for preventing the spread of infection, discuss their specific concerns, and explore if a different type of mask or a brief period of mask use during the most critical parts of ambulation is feasible, while preparing to escalate to a nurse if the patient remains unwilling. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a direct conflict between a patient's preference and a PCT's responsibility to maintain infection control standards. The PCT must balance patient comfort and autonomy with the critical need to prevent the spread of healthcare-associated infections, which can have severe consequences for vulnerable patients. The PCT's judgment is tested in navigating this delicate situation while adhering to established protocols. Correct approach analysis. The correct approach prioritizes patient safety and infection control, which are paramount in healthcare settings. By explaining the rationale behind PPE use and offering alternatives, the PCT upholds professional responsibility. This aligns with regulatory frameworks that mandate infection prevention measures to protect both patients and healthcare workers. Offering a compromise, such as a mask that is less restrictive or explaining the specific risks associated with the patient's condition, demonstrates a commitment to patient-centered care while maintaining safety standards. This approach reflects best professional practice by educating the patient, respecting their concerns where possible, and ultimately enforcing necessary safety protocols. Incorrect approach is analysis, refusing to wear PPE because the patient is uncomfortable and stating, "It's just a mask, it won't make a difference," is a direct violation of infection control policies and demonstrates a severe lack of professional judgment. This approach disregards established protocols designed to prevent transmission of pathogens, potentially endangering the patient and other individuals in the facility. It shows a failure to understand the importance of PPE in a healthcare environment and a disregard for regulatory requirements. Ignoring the patient's request and proceeding with care without addressing the PPE issue is also professionally unacceptable. While the PCT may be adhering to the PPE policy, failing to communicate and engage with the patient creates a breakdown in the therapeutic relationship. This approach neglects the ethical principle of patient autonomy and can lead to patient distress or noncompliance with care. It fails to acknowledge the patient's perspective and misses an opportunity for patient education and collaboration. Allowing the patient to refuse PPE and proceeding with care without any attempt to educate or find a compromise is a critical failure. This directly contravenes infection control mandates and exposes the patient and potentially others to unnecessary risk. It demonstrates a lack of understanding of the PCT's role in maintaining a safe healthcare environment and a failure to uphold professional responsibilities as outlined by regulatory bodies. Professional reasoning. When faced with a patient's refusal of necessary PPE, a PCT should follow a structured decision-making process. First, assess the specific risks associated with the patient's condition and the procedure being performed. Second, clearly and respectfully explain to the patient the rationale behind the PPE requirement, focusing on how it protects them and others. Third, explore potential compromises or alternative PPE options that might alleviate the patient's discomfort while still meeting safety standards. If the patient continues to refuse, and the PPE is deemed essential for safety by facility policy and regulatory guidelines, the PCT must escalate the situation to a supervisor or nurse to ensure appropriate intervention and documentation. This process emphasizes communication, education, and adherence to safety protocols. Question 3. Process analysis reveals that a patient care technician, PCT, is monitoring a patient who has recently undergone surgery. The PCT obtains the following vital signs: temperature 99, 8 degrees F, pulse 110 beats per minute, respiration 22 breaths per minute, and blood pressure 88/50 mmHg. The patient's baseline vital signs from earlier in the shift were within normal limits. What is the most appropriate immediate action for the PCT to take? Option A. Offer the patient a glass of water and reposition them before reporting. Option B. Retake the vital signs after waiting 15 minutes to see if they normalize. Option C. Document the abnormal vital signs in the patient's chart and continue routine monitoring. Option D. Immediately report the abnormal vital signs to the supervising nurse. The correct answer is D. Immediately report the abnormal vital signs to the supervising nurse. Explanation: scenario analysis. This scenario is professionally challenging because it requires a PCT to interpret and act upon vital signs that deviate from a patient's baseline and expected norms, while also considering potential external factors. The PCT must exercise critical judgment to determine the significance of these findings and the appropriate course of action, balancing patient safety with adherence to established protocols. The challenge lies in distinguishing between a transient fluctuation and a potentially serious change in the patient's condition. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety and timely intervention. Accurately measuring vital signs is a fundamental PCT responsibility. When deviations from the norm are observed, especially a significant drop in blood pressure and an elevated pulse, the PCT has a duty to report these findings immediately to the supervising nurse. This aligns with regulatory frameworks that mandate reporting of changes in patient status and adherence to facility policies for vital sign monitoring and emergency response. Prompt reporting ensures that the nursing staff can assess the patient, identify the cause of the changes, and initiate appropriate medical interventions, thereby preventing potential complications or deterioration. Incorrect approaches analysis. One incorrect approach involves assuming the readings are inaccurate and retaking them without reporting the initial findings. This is a regulatory and ethical failure because it delays necessary medical assessment and intervention. While equipment malfunction can occur, the PCT's primary responsibility is to report observed data, especially when it indicates a potential change in the patient's condition. Ignoring or delaying the reporting of abnormal vital signs can lead to a misdiagnosis or delayed treatment, violating the principle of beneficence and potentially causing harm. Another incorrect approach is to simply document the abnormal readings without reporting them to the supervising nurse. This is a failure to adhere to established protocols for patient care and communication. Regulatory guidelines and facility policies universally require PCTs to communicate significant changes in a patient's condition, including abnormal vital signs, to the licensed nurse. Documentation alone does not constitute an intervention or ensure that the patient receives the necessary medical attention. This omission can be considered a breach of professional duty and a violation of patient advocacy. A third incorrect approach is to attempt to correct the readings by adjusting the patient's position or offering fluids without first informing the supervising nurse. While these actions might be appropriate interventions in certain circumstances, they should only be performed under the direction of a licensed nurse. Forming interventions without proper authorization or assessment can be outside the PCT's scope of practice and could potentially mask or exacerbate the underlying issue, leading to a misdiagnosis or inappropriate treatment. This bypasses the essential step of professional assessment and communication. Professional reasoning. Professionals should approach this situation by first ensuring the accuracy of their measurements through proper technique. If the readings remain abnormal, the immediate and paramount step is to report these findings to the supervising nurse. This communication should be clear, concise, and include the specific vital signs observed and the patient's current status. The PCT should then await further instructions from the nurse. This decision-making process emphasizes a hierarchical reporting structure, patient advocacy, and adherence to the scope of practice, all of which are critical for ensuring patient safety and quality care within the regulatory framework. Question 4. Governance review demonstrates that a patient care technician, PCT, is assisting a patient who expresses a strong preference to discontinue a non-essential comfort measure that the PCT has been delegated to provide. The PCT believes the patient's preference is reasonable and would not negatively impact their immediate clinical status, but the current care plan does not reflect this change. What is the PCT's most appropriate course of action? Option A. Report the patient's preference directly to the physician overseeing the patient's care, bypassing the supervising nurse. Option B. Immediately inform the supervising nurse of the patient's expressed preference and the PCT's assessment, and await further instruction. Option C. Continue providing the comfort measure as per the existing care plan, as the PCT is not authorized to alter it. Option D. Directly discontinue the comfort measure, as the patient's wishes should be respected above all else. The correct answer is B. Immediately inform the supervising nurse of the patient's expressed preference and the PCT's assessment, and await further instruction. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the perceived best interests of their care, as interpreted by a healthcare professional. The PCT must navigate this delicate balance while adhering strictly to their defined scope of practice and the ethical principles governing patient care. Careful judgment is required to ensure patient autonomy is respected while also upholding safety and quality of care standards. The correct approach represents best professional practice because it prioritizes direct communication with the supervising nurse. This aligns with the PCT's defined role, which is to perform delegated tasks under the supervision of a licensed professional. The PCT's responsibility is to report observations and concerns, not to independently alter care plans or make clinical judgments beyond their scope. This approach ensures that any deviation from the patient's stated preference is addressed by the appropriate authority, who can then assess the situation, consult with the patient and the interdisciplinary team, and make an informed decision that is both clinically sound and ethically compliant with patient rights and facility policies. This upholds the principle of patient-centered care and ensures that the patient's voice is heard and considered within the established care framework. An incorrect approach that involves directly overriding the patient's stated preference without consulting the supervising nurse represents a significant ethical and regulatory failure. It violates the principle of patient autonomy, which is a cornerstone of healthcare ethics and is often codified in regulations regarding informed consent and patient rights. Furthermore, it exceeds the PCT's scope of practice, potentially leading to inappropriate care and undermining the authority and responsibility of the licensed nurse. Another incorrect approach, such as ignoring the patient's preference and continuing with the original plan without any communication, also fails ethically and regulatorily. This demonstrates a lack of respect for patient dignity and autonomy. It also neglects the PCT's duty to report changes in patient condition or patient concerns to the supervising nurse, which could lead to a breakdown in communication and potentially compromise patient safety. A third incorrect approach, such as immediately escalating the situation to a physician without first informing the supervising nurse, bypasses the established chain of command and the PCT's direct reporting line. While physicians are involved in care, the PCT's immediate supervisor for task delegation and patient care oversight is typically the licensed nurse. This failure to communicate with the nurse can lead to confusion, duplicated efforts, and a lack of coordinated care, all of which are detrimental to patient well-being and violate professional communication protocols. The professional decision-making process for similar situations should involve a clear understanding of one's scope of practice, a commitment to patient advocacy, and adherence to the established chain of command. When faced with a conflict between a patient's wishes and the current care plan, the PCT should first attempt to understand the patient's perspective. If the patient's wishes are within the PCT's ability to accommodate, or if they represent a deviation from the plan that requires attention, the PCT's immediate and primary responsibility is to communicate these observations and concerns to their supervising nurse. This ensures that the situation is addressed by the appropriate professional, who can then initiate further assessment, consultation, and decision-making in accordance with established protocols and ethical guidelines. Question 5. Cost-benefit analysis shows that implementing rigorous hand hygiene protocols for patient care technicians, PCT, incurs minimal time and resource costs, but yields substantial benefits in preventing the spread of infections. Considering these established principles of infection control, which of the following actions by a PCT best demonstrates adherence to these protocols after assisting a patient with ambulation to the bathroom? Option A. Use hand sanitizer only if the patient's skin appears visibly soiled. Option B. Assume that wearing gloves during the entire patient interaction negates the need for hand hygiene afterward. Option C. Skip hand hygiene if the PCT feels no immediate risk of exposure. Option D. Perform hand hygiene using soap and water or an alcohol-based hand rub. The correct answer is D. Perform hand hygiene using soap and water or an alcohol-based hand rub. Explanation. This scenario is professionally challenging because it requires a PCT to balance immediate patient needs with the critical, non-negotiable requirement of infection control. The challenge lies in recognizing that even seemingly minor deviations from protocol can have significant consequences for patient safety and public health. A PCT must possess a strong understanding of the principles of infection control and the ability to apply them consistently, even under pressure. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established protocols designed to prevent the spread of infection. This aligns directly with the core ethical and regulatory responsibilities of a PCT, which are rooted in the principle of do no harm and the legal mandates for healthcare providers to maintain a safe environment. Following the established protocol for hand hygiene before and after patient contact, and after contact with the patient's environment, is a fundamental pillar of infection control, as mandated by regulatory bodies such as the Centers for Disease Control and Prevention, CDC, and enforced through facility policies. This practice directly interrupts the chain of infection, protecting both the patient and the PCT from potential pathogens. An incorrect approach that involves skipping hand hygiene after touching a patient's Roman IV tubing, even if the tubing appears clean, represents a significant regulatory and ethical failure. This action disregards the principle of universal precautions, which assumes all bodily fluids and potentially contaminated surfaces can harbor infectious agents. Ethically, it violates the duty of care owed to the patient and potentially to other patients and staff. Legally, it could be considered negligence and a violation of healthcare regulations designed to prevent healthcare-associated infections. Another incorrect approach, such as using hand sanitizer only when visible dirt is present, is also a failure. While hand sanitizer is a valuable tool, it is not a substitute for thorough hand-washing with soap and water when indicated, and its efficacy can be compromised by certain types of contamination. Relying solely on visual inspection for the need for hand hygiene is insufficient and fails to meet the comprehensive requirements of infection control guidelines. This demonstrates a lack of understanding of the invisible nature of many pathogens and the importance of consistent, protocol-driven hygiene practices. A third incorrect approach, which is to assume that gloves eliminate the need for hand hygiene, is a critical misunderstanding of infection control principles. Gloves are a barrier, but they can be punctured, torn, or contaminated during use. Hand hygiene after glove removal is essential to remove any microorganisms that may have transferred to the PCT's hands, even if no breach in the glove was apparent. Failure to perform hand hygiene after glove use is a direct violation of infection control protocols and significantly increases the risk of cross-contamination. The professional decision-making process for similar situations should involve a constant internal checklist. Am I following established infection control protocols? This includes a thorough understanding of when and how to perform hand hygiene, the proper use of personal protective equipment, PPE, and the principles of environmental cleaning. When faced with a situation that might tempt a deviation, the PCT should pause and consider the potential consequences, referencing their training and facility policies. If unsure, seeking guidance from a supervisor or charge nurse is always the appropriate and safest course of action. The paramount consideration must always be patient safety and the prevention of infection. Question 6. Operational review demonstrates a situation where a registered nurse appears to be consistently delegating tasks to a patient care technician, PCT, that are outside the PCT's defined scope of practice, without adequate supervision or clear justification. The PCT expresses discomfort, but is hesitant to speak up due to perceived hierarchy. What is the most appropriate initial risk mitigation approach for the PCT? Option A. Discuss the registered nurse's actions with other PCTs to gather support and collectively decide on a course of action. Option B. Discreetly document the observed instances and seek a private conversation with the registered nurse to express concerns and clarify task delegation, offering to assist in understanding the PCT scope of practice. Option C. Continue performing the delegated tasks to avoid conflict and maintain team harmony, hoping the situation resolves itself over time. Option D. Immediately report the registered nurse to the facility's compliance officer, citing a breach of professional conduct and patient safety protocols. Correct answer is B. Discreetly document the observed instances and seek a private conversation with the registered nurse to express concerns and clarify task delegation, offering to assist in understanding the PCT scope of practice. Explanation. This scenario is professionally challenging because it involves a potential breakdown in communication and collaboration within the healthcare team, which directly impacts patient safety and care quality. The PCT's role requires them to be an integral part of this team, and understanding team dynamics is crucial for effective patient care. The correct approach represents best professional practice because it prioritizes open, respectful communication, and a collaborative problem-solving mindset. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as professional guidelines that emphasize teamwork and patient advocacy. By seeking clarification and offering support, the PCT actively contributes to a cohesive team environment, ensuring that all members are working towards the common goal of optimal patient outcomes. This proactive engagement also helps to prevent misunderstandings and potential errors. An incorrect approach that involves ignoring the situation or making assumptions about the nurse's actions would be a failure to uphold professional responsibility. This could lead to a breakdown in communication, potentially resulting in delayed or incorrect care for the patient. Ethically, this demonstrates a lack of patient advocacy and a disregard for the collaborative nature of healthcare. Another incorrect approach, such as directly confronting the nurse in a public or accusatory manner, would be unprofessional and could damage team morale and trust. While addressing concerns is important, the method of communication is critical. This approach could violate principles of respect and collegiality, hindering effective teamwork and potentially creating a hostile work environment, which indirectly affects patient care. A further incorrect approach, such as immediately escalating the issue to a supervisor without attempting to understand or resolve it at the team level, might be premature and could undermine the nurse's autonomy and the team's ability to self-correct. While escalation is sometimes necessary, it should typically be a last resort after attempts at direct, respectful communication have been made. This approach could be seen as a failure to engage in constructive problem-solving within the team. The professional decision-making process for similar situations should involve a risk assessment of the immediate impact on patient care, followed by an attempt to understand the situation through open and respectful communication. If concerns persist or if patient safety is directly compromised, then appropriate escalation protocols should be followed, always maintaining professionalism and a focus on patient well-being. Question 7. The audit findings indicate that a patient care technician, PCT, removed gloves after assisting a patient with personal hygiene, and then proceeded to adjust the patient's bed linens and touch the patient's intact arm before leaving the room. Which of the following actions best represents adherence to standard precautions in this scenario? Option A. Perform hand hygiene after leaving the patient's room and before touching the patient's intact arm. Option B. Perform hand hygiene only when hands are visibly soiled after the interaction. Option C. Perform hand hygiene immediately after removing gloves and before touching the patient's intact arm or adjusting linens. Option D. Perform hand hygiene after adjusting the bed linens and before touching the patient's intact arm. The correct answer is C. Perform hand hygiene immediately after removing gloves and before touching the patient's intact arm or adjusting linens. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the patient care technician, PCT, to interpret and apply infection control guidelines in a real-time patient care setting. The audit findings highlight a potential breakdown in adherence to standard precautions, which are fundamental to preventing the transmission of infections. The PCT must recognize the implications of their actions on patient safety, their own health, and the broader healthcare environment. The challenge lies in consistently prioritizing safety protocols even when faced with time pressures or perceived minor deviations. Correct approach analysis. The correct approach involves immediate and thorough hand hygiene after removing gloves and before touching any clean surfaces or the patient's intact skin. This aligns directly with CDC guidelines for standard precautions, which mandate hand hygiene as the single most effective way to prevent healthcare-associated infections. Specifically, hand hygiene is required before and after patient contact, after contact with blood, body fluids, or contaminated surfaces, and after removing gloves. This practice minimizes the risk of transmitting microorganisms from one patient to another or from the environment to the patient. Incorrect approach is analysis. Failing to perform hand hygiene after removing gloves and before touching the patient's intact skin represents a direct violation of standard precautions. This action increases the risk of transmitting pathogens from the contaminated gloves to the patient's skin, potentially leading to an infection. It also demonstrates a lack of understanding of the critical role hand hygiene plays in breaking the chain of infection. Performing hand hygiene only after leaving the patient's room, but before touching the patient's intact skin, is insufficient. Leaving the room is a point where hand hygiene is indicated. The critical breach occurred when the PCT touched the patient's intact skin without first performing hand hygiene after glove removal. This means potential contaminants from the gloves could have been transferred to the patient. Performing hand hygiene only when visibly soiled is a significant failure to adhere to standard precautions. Standard precautions are to be applied to all patients, regardless of their suspected or confirmed infection status, and hand hygiene is required at specific times, not solely based on visible contamination. This approach relies on a subjective assessment and misses opportunities to prevent transmission of microorganisms that are not visible. Professional reasoning. When faced with situations involving infection control, PCTs should adopt a proactive and diligent approach. The decision-making process should be guided by established protocols and a commitment to patient safety. This involves 1. Understanding and internalizing the principles of standard and transmission-based precautions. 2. Consistently performing hand hygiene at all indicated times. 3. Recognizing that even seemingly minor deviations can have serious consequences. 4. Prioritizing patient well-being and safety above all else, even when under pressure. 5. Seeking clarification or additional training if unsure about any aspect of infection control procedures. Question 8. Assessment of a patient who has suddenly become unresponsive and is not breathing requires immediate and decisive action. Which of the following approaches best reflects current basic life support (BLS) guidelines and professional best practice for a patient care technician (PCT) in this emergency situation? Option A. Attempt to locate the patient's medical chart and contact their family for information. Option B. Wait for a physician to arrive and assess the patient before initiating any interventions. Option C. Immediately begin high-quality chest compressions and call for advanced medical assistance. Option D. Administer any available emergency medications to the patient while assessing their condition. Correct answer is C. Immediately begin high-quality chest compressions and call for advanced medical assistance. Explanation. Scenario analysis. This scenario is professionally challenging because it requires immediate, decisive action in a high-stress situation where a patient's life is at risk. The PCT must accurately assess the situation, prioritize interventions based on established protocols, and communicate effectively with the healthcare team, all while maintaining patient dignity and safety. The urgency of basic life support demands a systematic and evidence-based approach, as any delay or incorrect action can have severe consequences. Correct approach analysis. The correct approach involves immediately initiating chest compressions and calling for advanced medical help. This aligns with current basic life support (BLS) guidelines, which emphasize early and high-quality cardiopulmonary resuscitation (CPR) as the most critical intervention for cardiac arrest. Promptly activating the emergency response system ensures that advanced life support personnel arrive as quickly as possible, increasing the patient's chance of survival and positive outcome. This approach prioritizes the most life-sustaining intervention based on established protocols. Incorrect approaches analysis. One incorrect approach is to first attempt to find the patient's medical history or contact their family. While gathering information is important, it is secondary to immediate life-saving measures in a cardiac arrest situation. Delaying CPR to search for records or contact family directly violates BLS protocols and significantly reduces the patient's chance of survival. This represents a failure to adhere to emergency response regulations and ethical obligations to provide immediate care. Another incorrect approach is to wait for a physician to arrive before initiating any interventions. BLS guidelines empower trained healthcare professionals, including PCTs, to begin CPR and activate emergency services when a patient shows signs of cardiac arrest. Waiting for a physician's direct order in such a critical, time-sensitive event constitutes a failure to act within the scope of practice and a dereliction of duty, potentially leading to irreversible harm or death. This is a failure to follow established emergency protocols and a breach of professional responsibility. A further incorrect approach is to administer medications without a physician's order or prior training in advanced cardiac life support. PCTs typically operate under the supervision of licensed nurses or physicians, and their scope of practice does not generally include independent medication administration in emergency situations, unless specifically trained and authorized. Attempting to administer medications without proper authorization and training is a violation of scope of practice regulations and could lead to patient harm. Professional reasoning. Professionals should approach such situations by first recognizing the signs of a life-threatening emergency. They must then systematically apply their BLS training, prioritizing immediate actions like chest compressions and calling for help. Effective communication with the healthcare team is crucial for seamless transition of care. Decision-making should be guided by established protocols, scope of practice, and ethical principles of beneficence and non-maleficence, ensuring the patient receives the most appropriate and timely care. Question 9. Comparative studies suggest that patient satisfaction is often linked to accommodating personal food preferences, yet patient care technicians must also ensure patient safety during feeding. A patient on a thickened liquids diet due to dysphagia expresses a strong desire for a specific type of soup that is not on their current meal plan and appears to be of a thinner consistency than their prescribed liquids. The PCT observes the patient struggling to manage even their thickened liquids. Option A. Provide the requested soup, assuming the patient knows best and can manage it, as their satisfaction is a priority. Option B. Consult with the supervising nurse and the registered dietitian to explore safe alternatives or modifications that might accommodate the patient's preference while adhering to their dietary restrictions and swallowing abilities. Option C. Inform the patient that their request cannot be met due to their dysphagia and proceed with serving the prescribed meal without further discussion. Option D. Encourage the patient to try their best to eat the prescribed meal, reminding them of their swallowing difficulties. The correct answer is B. Consult with the supervising nurse and the registered dietitian to explore safe alternatives or modifications that might accommodate the patient's preference while adhering to their dietary restrictions and swallowing abilities. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the patient care technician, PCT, to balance the patient's immediate needs and preferences with established dietary guidelines and the potential for aspiration. The patient's desire for a specific food item, coupled with their difficulty swallowing, creates a conflict that demands careful assessment and communication. The PCT must act as a patient advocate while adhering to safety protocols and physician's orders. Correct approach analysis. The correct approach prioritizes patient safety and adherence to medical orders. Consulting with the nurse and the registered dietitian ensures that any deviation from the prescribed diet is medically appropriate and safe for the patient. This collaborative approach upholds the principle of patient-centered care by seeking to accommodate preferences within safe parameters, while also respecting the expertise of other healthcare professionals. It aligns with regulatory frameworks that emphasize safe patient handling, accurate dietary management, and interdisciplinary communication to prevent adverse events like aspiration. Incorrect approaches analysis. Offering the requested food item without consultation fails to acknowledge the patient's swallowing difficulties and the physician's dietary orders. This bypasses essential safety checks and could lead to aspiration, a serious complication, violating the PCT's duty of care and potentially breaching regulations related to patient safety and scope of practice. Ignoring the patient's request and proceeding with the prescribed meal without further discussion disregards the patient's autonomy and preferences. While safety is paramount, a complete dismissal of the patient's expressed desires can negatively impact their overall well-being and adherence to the care plan. This approach may not fully align with patient-centered care principles. Suggesting the patient try their best to eat the prescribed meal without addressing the swallowing difficulty is negligent. It places the burden of managing a known risk entirely on the patient, without providing appropriate support or seeking professional guidance. This demonstrates a lack of understanding of the patient's condition and a failure to implement necessary safety precautions, potentially violating standards of care. Professional reasoning. When faced with a patient request that conflicts with their medical condition or prescribed care plan, the PCT should follow a structured decision-making process. 1. Assess the patient's current condition and any stated risks, e.g., swallowing difficulties. 2. Identify the patient's request and preferences. 3. Compare the request with the prescribed diet and physician's orders. 4. If a conflict exists, consult with the supervising nurse and relevant specialists, e.g., registered dietitian, to determine a safe and appropriate course of action. 5. Communicate the plan clearly to the patient, explaining the rationale for any decisions made. 6. Document all assessments, consultations, and actions taken. Question 10. System analysis indicates a patient in a healthcare facility has suddenly become unresponsive and is not breathing. A nearby patient care technician, PCT, is trained in the use of automated external defibrillators (ED) and has immediate access to one. The PCT recognizes the critical nature of the situation and the potential need for defibrillation. What is the most appropriate immediate action for the PCT to take? Option A. Locate the nearest physician and wait for their direct instruction before proceeding with any intervention. Option B. Immediately attach the AED pads to the patient and initiate the AED's analysis and shock delivery sequence. Option C. Begin chest compression while simultaneously calling for the facility's rapid response team or emergency medical services. Option D. Apply the AED to the patient and follow its prompts for analysis and shock delivery, after ensuring the emergency response system has been activated. The correct answer is B. Immediately attach the AED pads to the patient and initiate the AED's analysis and shock delivery sequence. Explanation. This scenario presents a professional challenge due to the immediate need for life-saving intervention in a critical medical emergency, coupled with the potential for patient harm if the AED is used improperly or if there is a delay in its application. The PCT must balance the urgency of the situation with the established protocols and their scope of practice. Careful judgment is required to ensure patient safety and adherence to legal and ethical standards. The correct approach represents best professional practice because it prioritizes immediate, appropriate action within the PCT's training and scope of practice, while also ensuring proper escalation and communication. Following established protocols for AED use, which typically involve assessing the patient, calling for advanced medical help, and then applying the AED if indicated, aligns with regulatory frameworks governing emergency medical care and the responsibilities of healthcare support personnel. This approach ensures that the patient receives timely intervention while minimizing risks associated with untrained or inappropriate use of medical equipment. It also upholds the ethical principle of beneficence by acting to help the patient. An incorrect approach of attempting to use the AED without confirming the patient's status or calling for advanced medical support would be a significant regulatory and ethical failure. It bypasses essential assessment steps, potentially leading to unnecessary defibrillation if the patient is not in cardiac arrest, which could cause harm. This also violates the principle of non-maleficence. Furthermore, failing to call for advanced medical help, e.g., paramedics or a physician, is a failure to adhere to emergency response protocols and could delay critical care that the PCT is not authorized to provide. Another incorrect approach of waiting for a physician to arrive before initiating AED use, even if the patient is unresponsive and not breathing, represents a failure to act in a timely manner, violating the principle of beneficence and potentially leading to irreversible harm due to delayed resuscitation. While respecting the chain of command is important, in a life-threatening emergency, immediate action within one's scope of practice is paramount. The professional decision-making process for similar situations should involve a rapid assessment of the patient's condition, immediate activation of the emergency response system, calling for advanced medical help, and then, if trained and indicated by the patient's condition, the application of the AED according to protocol. This process emphasizes a tiered response: assess, alert, and act within one's defined role and training. It requires understanding one's scope of practice, the specific emergency protocols of the facility, and the ethical imperative to act decisively and appropriately in a life-threatening situation. Question 11. To address the challenge of ensuring a patient room is safe for the next occupant after a patient's discharge, which of the following environmental cleaning and disinfection approaches best aligns with regulatory requirements and patient safety best practices for a patient care technician, PCT? Option A. Use a household bleach solution mixed at a non-standard concentration for a brief contact time. Option B. Rely on the patient's statement that they kept their personal belongings tidy and did not have any spills. Option C. Thoroughly clean all surfaces with an EPA-approved disinfectant, paying close attention to high-touch areas and ensuring the disinfectant remains in contact with surfaces for the manufacturer-specified duration. Option D. Perform a quick wipe-down of visible surfaces with a general-purpose cleaning solution to remove obvious debris. Correct answer is C. Thoroughly clean all surfaces with an EPA-approved disinfectant, paying close attention to high-touch areas and ensuring the disinfectant remains in contact with surfaces for the manufacturer-specified duration. Explanation. The scenario presents a common challenge in healthcare settings, maintaining a sterile environment while balancing efficiency and resource availability. Patient care technicians, PCT, are on the front lines of infection control, and their understanding of proper cleaning and disinfection protocols is paramount to patient safety and regulatory compliance. The challenge lies in selecting the most effective and appropriate method for disinfecting a patient room after discharge, considering the potential for pathogen transmission and the need to adhere to established guidelines. The correct approach represents best professional practice because it prioritizes patient safety and regulatory adherence, following established protocols for environmental cleaning and disinfection, which are typically based on guidelines from organizations like the Centers for Disease Control and Prevention, CDC, in the U.S., ensures that all potentially infectious materials are eliminated or inactivated. This minimizes the risk of healthcare-associated infections, for subsequent patients and staff. Proper disinfection involves using EPA-approved disinfectants at the correct concentration and for the specified contact time, targeting high-touch surfaces and areas where bodily fluids may have been present. This meticulous approach directly aligns with the ethical responsibility to provide safe patient care and the legal obligation to comply with infection control regulations. An incorrect approach that involves a cursory wipe-down with a general-purpose cleaner without specific disinfection would be a significant regulatory and ethical failure. This method would not effectively eliminate or inactivate a broad spectrum of pathogens, leaving the room at risk for transmission. It violates the fundamental principles of infection control and the regulatory requirements for environmental hygiene in healthcare facilities. Another incorrect approach, such as relying solely on the patient's self-reported cleanliness or using a disinfectant not approved for healthcare settings, also poses serious risks. These actions demonstrate a lack of understanding of the infectious nature of the healthcare environment and a failure to uphold professional standards, potentially leading to patient harm and regulatory penalties. Professional decision-making in such situations requires a systematic approach. First, identify the specific task and its objective to safely prepare a patient room for the next occupant. Second, recall and apply established protocols and guidelines relevant to environmental cleaning and disinfection. This includes understanding the types of disinfectants to be used, their appropriate application, and the surfaces requiring attention. Third, assess the available resources and ensure they meet the protocol requirements. Finally, execute the task with diligence and attention to detail, recognizing the direct impact on patient well-being and facility compliance. Question 12. Cost-benefit analysis shows that a particular therapeutic intervention offers a high probability of significant improvement in a patient's condition. However, the patient, who is deemed competent, adamantly refuses the intervention, citing personal beliefs and a desire to avoid potential side effects. The PCT is aware of the potential benefits, but also the patient's strong conviction. What is the most ethically and professionally appropriate course of action for the PCT? Option A. Attempt to persuade the patient to accept the intervention by emphasizing the severity of their condition and the risks of noncompliance. Option B. Document the patient's refusal and inform the supervising nurse and physician of the patient's decision while respecting their autonomy. Option C. Proceed with the intervention as planned, as the potential benefits outweigh the patient's stated concerns, and document the team's decision. Option D. Inform the patient that their refusal will negatively impact their care plan and potentially lead to a less favorable outcome, without further discussion. The correct answer is B. Document the patient's refusal and inform the supervising nurse and physician of the patient's decision, while respecting their autonomy. Explanation. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the perceived best interests of their care, as determined by the healthcare team. The PCT must navigate this delicate balance while upholding patient autonomy and dignity, adhering to ethical principles and regulatory guidelines. Careful judgment is required to ensure that the patient's rights are respected without compromising their safety or well-being. The correct approach, which involves open communication with the patient and the interdisciplinary team to understand the underlying reasons for the patient's refusal and to explore alternatives, represents best professional practice. This aligns with the ethical principle of patient autonomy, which dictates that competent patients have the right to make informed decisions about their own healthcare, even if those decisions differ from what the healthcare provider believes is best. It also adheres to regulatory frameworks that emphasize patient rights, informed consent, and the importance of a collaborative approach to care planning. By seeking to understand the patient's perspective and involving them in decision-making, the PCT fosters trust and promotes a patient-centered care model. An incorrect approach that involves overriding the patient's wishes based solely on the team's assessment of benefit would be a significant ethical and regulatory failure. This disregards the principle of autonomy and could be construed as paternalistic care, violating the patient's right to self-determination. Another incorrect approach, such as documenting the refusal without further investigation or discussion, fails to uphold the PCT's responsibility to advocate for the patient and ensure their care plan is appropriate and understood. This passive approach neglects the opportunity to address potential misunderstandings or underlying issues that might be influencing the patient's decision. A third incorrect approach, which involves pressuring the patient to comply, is coercive and undermines the foundation of trust essential for effective patient care. This violates the ethical principle of non-maleficence by potentially causing distress and eroding the patient's sense of control. Professionals should employ a decision-making framework that prioritizes patient-centered communication. This involves actively listening to the patient, seeking to understand their values and concerns, and clearly explaining the rationale behind recommended interventions. When conflicts arise, the framework should guide the professional to involve the patient in problem-solving, explore alternative solutions collaboratively with the interdisciplinary team, and document all discussions and decisions thoroughly. This ensures that care is delivered in a manner that respects patient autonomy, promotes well-being, and complies with all applicable regulations and ethical standards. Question 13. The efficiency study reveals that patient care technician, PCT Sarah, has been diligently monitoring her assigned patients. During her shift, she notices that Mr. Henderson, a post-operative patient, is exhibiting increased restlessness and is complaining of mild discomfort, which is a slight increase from his baseline pain level reported an hour ago. Sarah also observes that his respiratory rate has subtly increased from 16 to 18 breaths per minute. Considering these observations, what is the most appropriate immediate action for Sarah to take? Option A. Inform the assigned licensed nurse about Mr. Henderson's increased restlessness, subjective discomfort, and slightly elevated respiratory rate. Option B. Document the observations in the patient's chart and wait to report them to the nurse at the end of her shift to consolidate information. Option C. Report the observations to another PCT who is also caring for patients on the unit. Option D. Advise Mr. Henderson to try deep breathing exercises and monitor him for another hour before reporting any changes. Correct answer is B. Document the observations in the patient's chart and wait to report them to the nurse at the end of her shift to consolidate information. Explanation. Scenario analysis. This scenario is professionally challenging because the PCT is the frontline observer of subtle but significant changes in a patient's condition. The challenge lies in accurately assessing the severity of the change, determining the urgency of reporting, and communicating effectively to the nursing staff, who are managing multiple patients. Misinterpreting or delaying reporting can have serious consequences for patient safety and outcomes. Correct approach analysis. Promptly and accurately reporting any observed change in a patient's status, no matter how minor it may seem, to the licensed nurse is the cornerstone of safe patient care and aligns with the PCT's scope of practice, as defined by regulatory frameworks for patient care technicians. This proactive communication ensures that the nursing staff can make timely and informed clinical decisions, initiate appropriate interventions, and prevent potential deterioration. This practice is ethically mandated by the principle of beneficence, acting in the patient's best interest, and is a fundamental requirement for maintaining patient safety, as outlined in most healthcare facility policies and state-specific PCT regulations, which emphasize the PCT's role in observation and reporting. Incorrect approaches analysis. Failing to report a change because it seems minor or the PCT believes they can manage it independently is a critical failure. This violates the PCT's defined scope of practice, which does not include independent clinical judgment for changes in patient status. It also breaches the ethical duty to report potential harm and disregards regulatory requirements that mandate reporting observations to licensed personnel. This approach risks patient deterioration and adverse events. Delaying reporting until the end of the shift or until a more significant change occurs is also unacceptable. This delay can lead to a critical window for intervention being missed, potentially worsening the patient's condition. It demonstrates a lack of understanding of the urgency required in healthcare settings and a failure to prioritize patient safety, which is a core ethical and regulatory expectation. Reporting the change to another PCT or a different healthcare team member who is not a licensed nurse before informing the assigned nurse is a breach of the reporting hierarchy and scope of practice. While collaboration is important, the direct reporting line to the licensed nurse is crucial for immediate assessment and intervention. This bypasses the established chain of command and can lead to miscommunication or delayed action by the responsible nurse. It also fails to adhere to facility policies and regulatory guidelines regarding direct reporting of patient status changes. Professional reasoning. When observing a change in a patient's status, a PCT should follow a clear decision-making process. 1. Observe and assess. Note the specific change and its potential implications. 2. Prioritize urgency. Determine if the change requires immediate reporting or can wait for a brief moment. 3. Report directly. Communicate the observation clearly and concisely to the assigned licensed nurse, providing objective data e.g. vital signs, patient's subjective report, observed symptoms. 4. Document as per facility policy. Follow facility guidelines for documenting the observation and the report to the nurse. This systematic approach ensures patient safety, adheres to professional responsibilities, and complies with regulatory and ethical standards. Question 14. Risk assessment procedures indicate that a patient care technician, PCT, is monitoring a post-operative patient. The PCT observes a slight but consistent decrease in the patient's blood pressure over the last hour, which is now at the lower end of the patient's normal range but not yet critically low. The patient denies any discomfort. What is the most appropriate immediate action for the PCT to take? Option A. Immediately initiate a rapid response team activation due to the decreasing blood pressure. Option B. Continue monitoring the patient and wait to see if the blood pressure drops further before taking any action. Option C. Attempt to administer a prescribed intravenous fluid bolus to increase the blood pressure. Option D. Document the vital signs accurately and immediately report the trend and specific readings to the registered nurse. The correct answer is D. Document the vital signs accurately and immediately report the trend and specific readings to the registered nurse. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a patient care technician, PCT, to interpret and act upon subtle changes in a patient's vital signs, balancing the need for timely intervention with the risk of overescalation or misinterpretation. The PCT must rely on their observational skills, understanding of normal physiological parameters, and knowledge of when to involve a registered nurse, RN, or other healthcare professionals. The challenge lies in discerning a clinically significant deviation from a transient fluctuation, ensuring patient safety without causing unnecessary alarm or disruption. Correct approach analysis. The correct approach involves the PCT accurately observing and documenting the patient's vital signs, noting the specific deviation from the baseline, and then promptly and clearly communicating these findings to the RN. This aligns with the PCT's scope of practice, which typically includes monitoring vital signs and reporting changes. The U.S. regulatory framework for PCTs emphasizes the importance of accurate data collection and reporting to the supervising RN, who is then responsible for further assessment and intervention. This ensures that patient care decisions are made by licensed professionals with a broader scope of responsibility, while leveraging the PCT's direct patient observation skills. Ethical practice dictates that patient well-being is paramount and timely. Accurate reporting is a cornerstone of this. Incorrect approaches analysis. One incorrect approach involves the PCT ignoring the slight drop in blood pressure, assuming it is insignificant. This is a regulatory and ethical failure because it neglects the PCT's responsibility to report all observed changes, even subtle ones, that could indicate a developing problem. The U.S. framework requires PCTs to be vigilant and report deviations, as what may seem minor could be an early sign of a serious condition. This approach prioritizes convenience over patient safety. Another incorrect approach is for the PCT to immediately call for emergency medical services, EMS, without first assessing the situation further or consulting the RN. While prompt action is important, Bypassing the RN in this instance is a scope of practice violation. PCTs are not authorized to independently initiate such high-level interventions. This could lead to unnecessary resource allocation and patient distress, and it undermines the established chain of command and the RN's role in patient management, which is a failure in adhering to established healthcare protocols and potentially violating state-specific PCT regulations. A third incorrect approach is for the PCT to attempt to administer medication or adjust the patient's position without a physician's order or RN's direction. This is a severe scope of practice violation and a direct breach of patient safety regulations. PCTs are not licensed to prescribe or administer medications or independently alter patient treatment plans. Such actions could have dangerous consequences for the patient and expose the PCT and the healthcare facility to significant liability, violating numerous federal and state healthcare laws and professional conduct guidelines. Professional reasoning. Professionals should employ a systematic approach. 1. Observe and accurately document all vital signs and any patient-reported symptoms. 2. Compare current readings to the patient's baseline and normal ranges. 3. Identify any deviations that fall outside acceptable parameters or represent a significant change. 4. Communicate these findings clearly and concisely to the supervising RN, including the specific vital sign, the degree of deviation, and any associated symptoms. 5. Follow the RN's instructions for further action. This process ensures patient safety, adheres to scope of practice, and upholds regulatory and ethical standards. Question 15. Consider a scenario where a patient care technician, PCT, is preparing to assist a patient with a new mobility aid, such as a walker. The patient appears anxious and has indicated they have some difficulty hearing. How should the PCT best approach explaining the use of the walker to ensure patient understanding and cooperation? Option A. Tell the patient that the walker is simple to use and they shouldn't worry, and proceed with the demonstration without further explanation. Option B. Use technical medical terms to accurately describe the walker's mechanics and then proceed with the demonstration. Option C. Briefly demonstrate the walker's use while speaking at a normal pace, assuming the patient will grasp the concept quickly. Option D. Speak slowly and clearly, using simple terms, and ask the patient to repeat back the instructions to confirm understanding. The correct answer is D. Speak slowly and clearly, using simple terms, and ask the patient to repeat back the instructions to confirm understanding. Explanation. This scenario presents a professional challenge due to the inherent vulnerability of the patient and the critical need for clear, empathetic communication to ensure their understanding and cooperation with care. The PCT must navigate the patient's potential anxiety, cognitive limitations, and the importance of respecting their autonomy while fulfilling their caregiving duties. Careful judgment is required to balance the need for efficient care delivery with the patient's right to be informed and involved. The correct approach represents best professional practice because it prioritizes patient-centered communication. This involves using simple, clear language, checking for understanding, and allowing the patient time to process information and ask questions. This aligns with the ethical principles of beneficence, acting in the patient's best interest by ensuring comprehension and autonomy, respecting the patient's right to make informed decisions about their care. Furthermore, regulatory frameworks for patient care technicians often emphasize the importance of effective communication in preventing errors, promoting patient safety, and fostering a trusting patient-provider relationship. This approach ensures the patient feels respected and empowered, contributing to a more positive care experience and potentially better health outcomes. An incorrect approach that involves speaking rapidly and using complex medical jargon fails to respect the patient's right to understand their care. This can lead to confusion, anxiety, and a lack of adherence to treatment plans, potentially violating the principle of non-maleficence by causing harm through misunderstanding. It also undermines patient autonomy by effectively preventing informed consent. Another incorrect approach, which involves assuming the patient understands without verification, neglects the PCT's responsibility to ensure comprehension. This can lead to critical information being missed, increasing the risk of adverse events and contravening the duty of care. Finally, an approach that dismisses the patient's questions or concerns as unimportant is a direct violation of ethical principles of respect and dignity. It can erode trust, create a hostile care environment, and potentially lead to the patient withholding important information, all of which are professionally unacceptable and may have regulatory implications regarding patient rights and quality of care standards. Professionals should employ a decision-making framework that begins with assessing the patient's communication needs and cognitive status. This involves active listening, observing nonverbal cues, and adapting communication style accordingly. The PCT should then clearly and concisely explain procedures or information, using language the patient can understand. Crucially, they must incorporate teach-back methods to confirm comprehension and encourage questions. This iterative process of explaining, checking, and clarifying ensures that the patient is an active participant in their care, fostering a collaborative and safe environment. Question 16. The investigation demonstrates a patient care technician, PCT, observing a patient who has recently undergone surgery. The PCT notes a slight increase in the patient's respiratory rate and a subtle change in skin color from pink to a slightly paler hue. The PCT also recalls the patient mentioning feeling a bit more tired than earlier in the shift. Considering the PCT's responsibilities in observing and documenting patient conditions, which of the following actions best reflects professional practice? Option A. Document the observed increase in respiratory rate and the change in skin color factually in the patient's chart, noting the patient's subjective report of feeling tired. Option B. Discuss the patient's subtle changes in color and breathing with another PCT in the break room to get their opinion before charting. Option C. Interpret the patient's increased tiredness as a normal post-operative symptom and focus documentation on vital signs only. Option D. Document the patient's subjective feeling of tiredness as a significant decline in condition without noting the objective vital sign changes. The correct answer is A. Document the observed increase in respiratory rate and the change in skin color factually in the patient's chart, noting the patient's subjective report of feeling tired. Explanation. This scenario is professionally challenging due to the potential for misinterpretation of subtle patient changes, which can lead to delayed or incorrect interventions. The PCT's role in observing and documenting is critical for continuity of care and patient safety, requiring keen attention to detail and accurate reporting. The correct approach represents best professional practice because it prioritizes objective, factual documentation aligned with the patient care technician's scope of practice and facility protocols. This ensures that healthcare providers receive accurate information to make informed clinical decisions, directly supporting patient well-being and adhering to guidelines that mandate precise record keeping. Accurate documentation is a legal and ethical imperative, forming the basis of the patient's medical record. An incorrect approach that relies on subjective interpretation or personal opinion fails to meet professional standards. Such documentation can be misleading, potentially causing harm to the patient if it influences subsequent care based on inaccurate observations. This violates the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Furthermore, it may contravene facility policies and potentially regulatory requirements for accurate and objective charting. Another incorrect approach that involves omitting relevant observations, even if they seem minor, is a significant ethical and professional failing. This omission can obscure a developing trend or a critical change in the patient's condition, hindering timely medical intervention. It represents a breach of the PCT's duty to observe and report, potentially leading to adverse patient outcomes and violating the trust placed in them by the patient and the healthcare team. A further incorrect approach that involves discussing patient observations with unauthorized individuals constitutes a breach of patient confidentiality. This violates privacy regulations and ethical codes that protect patient information. Maintaining confidentiality is paramount and essential for building trust and ensuring patient privacy. The professional decision-making process for similar situations should involve a systematic approach. First, observe the patient's condition thoroughly and objectively. Second, document these observations accurately and factually, using clear and concise language, adhering to facility protocols. Third, report any significant changes or concerns to the appropriate healthcare professional e.g., nurse, promptly. Finally, always maintain patient confidentiality and professional boundaries. This structured approach ensures that observations are translated into actionable information that supports optimal patient care. Question 17. Upon reviewing a post-operative patient who underwent abdominal surgery 24 hours ago, you observe that their previously clear breath sounds are now diminished in the bases bilaterally, and they are complaining of a new, sharp pain in their right shoulder that is worse with inspiration. The patient's vital signs remain within their established postoperative parameters. What is the most appropriate immediate action? Option A. Immediately report these findings to the supervising nurse. Option B. Encourage the patient to take deep breaths and cough to clear their lungs. Option C. Document the findings and continue routine monitoring. Option D. Reassess the patient in 1 hour to see if the symptoms have changed. The correct answer is A. Immediately report these findings to the supervising nurse. Explanation. This scenario is professionally challenging because it requires the patient care technician, PCT, to move beyond simply observing a patient's condition to actively interpreting potentially subtle but significant deviations from their baseline. The challenge lies in distinguishing between normal postoperative recovery and the early signs of a serious complication, necessitating prompt and accurate reporting. The correct approach represents best professional practice because it prioritizes patient safety and adheres to the fundamental principle of timely communication of critical patient information. By immediately reporting the observed changes, the PCT ensures that the nursing staff and physician are alerted to a potential problem, allowing for swift assessment and intervention. This aligns with regulatory frameworks that mandate PCTs to report changes in patient condition to their supervising nurse, as outlined in state nurse practice acts and facility policies, which are designed to protect patient well-being and prevent adverse outcomes. An incorrect approach of waiting to see if the symptoms worsen is a significant regulatory and ethical failure. It violates the PCT's responsibility to report changes in patient status, potentially delaying critical care and leading to patient harm. This inaction could be considered negligence, as it fails to meet the standard of care expected of a healthcare professional. Furthermore, it disregards facility policies and potentially state regulations that define the scope of practice and reporting duties for PCTs. Another incorrect approach, assuming the symptoms are normal without further assessment or reporting, demonstrates a lack of critical thinking and a failure to recognize abnormal signs. This can lead to misdiagnoses and delayed treatment, directly contravening the ethical obligation to act in the patient's best interest and the regulatory requirement to report observed changes. The professional reasoning process for similar situations involves a systematic approach. 1. Observe the patient's current state. 2. Compare these observations to the patient's known baseline and expected recovery. 3. Identify any deviations that are unusual or concerning. 4. Immediately report these deviations to the supervising nurse, providing clear and concise details of the observations. 5. Document the observations and the reporting action taken. This process ensures that patient care is proactive and responsive to changing needs. Question 18. The performance metrics show a higher than average rate of specimen rejection for capillary glucose tests performed by a specific patient care technician on pediatric patients. What is the most appropriate initial step to address this trend? Option A. Review the PCT's technique for capillary puncture, focusing on site selection, lancet depth, and specimen collection to ensure adherence to established protocols. Option B. Assume the pediatric patients are simply difficult to obtain adequate samples from and adjust expectations for specimen quality. Option C. Counsel the PCT on the importance of speed and efficiency in specimen collection to reduce patient wait times. Option D. Immediately implement a policy requiring all pediatric capillary glucose tests to be performed by a registered nurse instead of the PCT. The correct answer is A. Review the PCT's technique for capillary puncture, focusing on site selection, lancet depth, and specimen collection to ensure adherence to established protocols. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the patient care technician, PCT, to balance the need for accurate diagnostic information with the patient's comfort and safety, particularly when dealing with a pediatric patient. The performance metrics indicate a potential issue with the capillary puncture technique, necessitating a review of the PCT's practice to ensure adherence to established protocols and patient well-being. The risk of causing unnecessary pain or injury to a child, coupled with the potential for inaccurate results due to improper technique, demands careful judgment and a thorough understanding of best practices. Correct approach analysis. The correct approach involves a comprehensive review of the PCT's technique, focusing on the specific steps of capillary puncture. This includes assessing the site selection, the depth and angle of the lancet insertion, the milking technique, if any, and the collection method. The goal is to identify any deviations from the recommended procedure that could lead to hemolysis, inaccurate readings, or patient discomfort. Adherence to established protocols, such as those outlined by the Clinical and Laboratory Standards Institute, CLSI, for capillary blood specimen collection, is paramount. This ensures patient safety, specimen integrity, and the generation of reliable test results, all of which are ethical and regulatory imperatives for PCTs. Incorrect approach is analysis. One incorrect approach would be to dismiss the performance metrics as insignificant or a one-time occurrence without further investigation. This fails to acknowledge the potential for systemic issues in technique or training, and could lead to continued suboptimal patient care and inaccurate results, violating the ethical duty to provide competent care and potentially contravening facility policies and regulatory guidelines that mandate quality assurance. Another incorrect approach would be to immediately assume the PCT is intentionally performing the procedure incorrectly. This is a judgmental and unprofessional response that bypasses a proper assessment of the situation. It fails to consider that the issue might stem from a lack of training, misunderstanding of the procedure, or equipment malfunction, and it erodes trust and a positive working relationship, which is counterproductive to improving performance and patient care. A third incorrect approach would be to focus solely on the speed of the procedure, assuming that faster is always better. While efficiency is important, it should never come at the expense of accuracy or patient safety. Rushing the capillary puncture can lead to increased pain, tissue damage, and specimen contamination or hemolysis, all of which compromise the quality of the collected sample and the reliability of the test results. This approach neglects the core principles of patient care and specimen integrity. Professional reasoning. When faced with performance metrics that suggest a deviation from expected outcomes, a PCT should employ a systematic approach. This involves 1. Reviewing the specific data to understand the nature of the deviation. 2. Consulting relevant protocols and guidelines e.g. CLSI facility-specific policies. 3. Observing the procedure in question, if possible, or discussing it directly with the individual involved. 4. Providing constructive feedback and retraining as necessary. And 5. Documenting the review and any corrective actions taken. This process ensures that patient care remains safe, effective, and compliant with all applicable standards. Question 19. Examination of the data shows a patient in a long-term care facility requests the patient care technician, PCT, to retrieve and administer an over-the-counter OC pain reliever from their personal belongings for a headache. The PCT is aware that the patient has a history of gastrointestinal issues. Which of the following actions best reflects the PCT's duties and adherence to regulatory guidelines? Option A. Retrieve the OTC pain reliever from the patient's belongings and administer it as requested, as it is an over-the-counter medication. Option B. Obtain the OTC pain reliever from the patient's belongings and give it to the patient to self-administer. Option C. Locate the OTC pain reliever in the patient's belongings and administer it after confirming the dosage with the patient. Option D. Inform the patient that the PCT cannot administer any medications and advise them to ask the nurse. The correct answer is A. Retrieve the OTC pain reliever from the patient's belongings and administer it as requested, as it is an over-the-counter medication. Explanation. Scenario analysis. This scenario presents a common challenge for patient care technicians, PCT, where a patient's request, while seemingly simple, could potentially fall outside the defined scope of practice for a PCT. The challenge lies in balancing patient comfort and autonomy, with the need to adhere strictly to regulatory guidelines and facility policies that delineate PCT responsibilities. Misinterpreting the scope of practice can lead to patient harm, legal repercussions, or disciplinary action. Correct approach analysis. The correct approach involves recognizing the request and then appropriately escalating it to the licensed nurse. This aligns with the regulatory framework for PCTs, which emphasizes performing tasks under the direct supervision of a licensed healthcare professional. PCTs are trained to assist with basic care needs, but tasks involving medication administration, even over-the-counter OC items, typically require a licensed nurse's assessment and authorization. This ensures patient safety, proper dosage, and documentation, all of which are critical components of patient care governed by state nurse practice acts and facility policies. Incorrect approach is analysis. One incorrect approach is to directly fulfill the request by retrieving and administering the OTC medication. This is a failure to adhere to the PCT scope of practice. State Nurse Practice Acts and facility policies clearly define that medication administration, including OTCs, is the responsibility of licensed nursing personnel. Performing this action could be considered practicing nursing without a license or exceeding the authorized scope of practice, leading to potential patient harm if the medication is contraindicated or if there are drug interactions. Another incorrect approach is to ignore the request entirely. While this avoids overstepping boundaries, it fails to address the patient's expressed need and can negatively impact patient satisfaction and trust. PCTs are expected to be responsive to patient needs within their scope. Ignoring a request, even if it requires escalation, can be seen as a lapse in patient advocacy and communication, which are implicit duties of a PCT. A third incorrect approach is to provide general advice about the medication without offering to involve the nurse. For example, suggesting the patient take it if they feel it's necessary. This is problematic because it can be interpreted as indirectly advising on medication use, which again falls outside the PCT's scope. The PCT should not be making any judgment calls about the appropriateness of the medication for the patient. Professional reasoning. When faced with a patient request that might be outside the PCT's scope of practice, the professional decision-making process should involve 1. Identify the patient's request and the underlying need. 2. Assess if the request falls within the defined scope of practice for a PCT, referencing specific job descriptions, facility policies, and state regulations. 3. If the request is outside the scope, do not perform the task independently. 4. Communicate the patient's request to the appropriate licensed professional, e.g., registered nurse, for assessment and authorization. 5. Document the communication and the subsequent actions taken by the licensed professional. 6. Maintain a patient-centered approach by ensuring the patient's needs are addressed through the proper channels. Question 20. Performance analysis shows that a patient care technician, PCT, is assisting a patient who states they no longer wish to use their prescribed assistive device for ambulation, despite recent documentation indicating its necessity for safe mobility. What is the most appropriate immediate action for the PCT? Option A. Ignore the patient's statement and continue with the current care plan without further inquiry. Option B. Attempt to understand the patient's reason for not wanting to use the device and assess for any signs of distress or changes in their condition, reporting any concerns to the supervising nurse. Option C. Proceed to remove the assistive device as requested by the patient without any further assessment or communication. Option D. Immediately insist that the patient use the assistive device as prescribed, overriding their stated preference. The correct answer is B. Attempt to understand the patient's reasons for not wanting to use the device and assess for any signs of distress or changes in their condition, reporting any concerns to the supervising nurse. Explanation. Scenario analysis. This scenario presents a common challenge for patient care technicians, PCT, involving the delicate balance between patient autonomy and the need for safety and appropriate care. The challenge lies in interpreting a patient's stated preference against observable signs that might indicate a need for intervention beyond what the patient is requesting. The PCT must assess the situation, consider potential risks, and act within their scope of practice while respecting the patient's wishes. This requires keen observation skills, critical thinking, and effective communication. Correct approach analysis. The correct approach prioritizes patient safety and well-being while adhering to professional ethical standards and regulatory guidelines for PCTs. It involves a systematic process of assessment, communication, and escalation when necessary. By first attempting to understand the patient's reasoning and then assessing for any signs of distress or compromise, the PCT is gathering crucial information. If the assessment reveals any potential harm or a decline in the patient's condition, reporting these findings to the supervising nurse is the appropriate and mandated action. This aligns with the PCT's responsibility to observe and report, ensuring that the patient receives the necessary level of care as determined by a qualified healthcare professional. This approach upholds the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, while also respecting patient autonomy within the bounds of safety. Incorrect approach is analysis. One incorrect approach involves immediately complying with the patient's request without further assessment. This fails to acknowledge the PCT's responsibility to observe and report any changes in patient condition or potential safety risks. It could lead to patient harm if the patient's request, though stated, is not in their best interest due to an underlying issue the patient may not be fully aware of or able to articulate. This neglects the duty of care and could be a violation of regulatory expectations for PCTs to act as vigilant observers. Another incorrect approach is to dismiss the patient's request outright and insist on a different course of action without understanding the patient's perspective or conducting a proper assessment. This disrespects patient autonomy and can erode trust. While the PCT has a duty to ensure safety, this approach lacks the necessary communication and assessment steps, potentially leading to patient dissatisfaction and a breakdown in the therapeutic relationship. It also bypasses the proper reporting chain if the patient's request, while unusual, might have a valid underlying reason that needs to be explored by the nursing staff. A third incorrect approach is to ignore the patient's request and continue with routine tasks without any interaction or assessment. This demonstrates a lack of engagement and a failure to recognize the patient's expressed needs or concerns. It is a dereliction of the PCT's role in providing direct patient care and observation, potentially leaving a patient in a compromised or unsafe situation. This directly violates the expectation that PCTs are actively involved in monitoring patient status and responding to patient needs within their scope. Professional reasoning. When faced with a patient's request that seems unusual or potentially contrary to their well-being, a PCT should employ a structured decision-making process. This begins with active listening and attempting to understand the patient's rationale. Following this, a focused assessment of the patient's current condition, vital signs, and any observable signs of distress or change is crucial. If the assessment reveals any concerns, or if the patient's request could potentially lead to harm, the PCT must then communicate these findings and concerns clearly and concisely to the supervising nurse. This ensures that the patient's care plan is reviewed and adjusted as needed by the appropriate healthcare professional, upholding both patient rights and professional responsibilities.